Hello listeners, it's Suleiman here, your host of your Weekly Dose of Neuroscience, back with another episode. Today I'll be discussing a classic neuroscientific debate, popular with people just starting to learn about treatment and diagnosis methods. Which is better, CT or MRI scans? Specifically, I'll be reviewing these procedures with regards to diagnosing brain tumors, focusing on the respective mechanisms, efficiency and effectiveness, methodological concerns, and touching upon ethical issues, such as risks and benefits. As we are aware, neuroimaging plays a huge role in the education as well as healthcare aspects of neuroscience, as it allows neuroscientists to work alongside engineers and physicists to develop and fine-tune technological advancements, which provide an abundance of data surrounding the workings of the brain, overall saving lives. I'll begin by establishing the roles of these mechanisms in brain research. CT, or computed tomography, works by the usage of many X-rays to create cross-sectional images of the brain. Its particular specialty is detecting bleeding, tumors, or fractures, as it is relatively quick to use and highlights sections of the body with different densities. MRI, or magnetic resonance imaging, on the other hand, uses a strong magnetic field as well as radio waves to produce high-quality images of the brain. Its notable features include detecting abnormalities for soft tissues, locating for tumors, and progression. Both are highly effective measuring techniques of data acquisition for the brain. So how exactly does a CT scan utilize X-rays to create a 3D image, you may wonder? As you may know, X-rays work by shooting ionizing radiation beams through an object, whose intensity is then captured by detectors, relayed onto a computer, which then reconstructs the image using different shades to highlight densities of whatever was scanned. The denser an object, the brighter it appears on the constructed image. And CT scans use this technology by multiplying the number of X-rays and measuring the body in slices. These slices are usually up to a few millimeters in thickness and are used to reconstruct a whole image piece by piece, which happens on a computer relatively quickly. It usually takes up to 5 minutes, thus is considered much more efficient than an MRI scanner, as it can be used to find tumors instantly. CT scans are effective with determining the effects of tumors on the skull and bones, and also to determine the best treatment for said tumors, though falls short in detailing the soft tissue and blood vessels on the image reconstructed. Hence the MRI. So now that we understand the CT scan, let's dive into the MRI. MRIs are actually quite different as they do not use X-rays at all. The National Institute of Biomedical Imaging and Bioengineering's website, last updated in 2019, tells us that magnetic resonance imaging utilizes powerful magnets, which create a strong magnetic field that causes the protons of hydrogen atoms in the body to align with. A radio frequency current is pulsed through the patient's body, causing the protons to spin out of equilibrium, straining against the pull of that field. Once that radio frequency field is off, the MRI sensors detect the energy released by the protons upon realigning with the magnetic field, reconstructing the image of the part of the body scanned. The faster the protons align, the higher quality the image is. Thus, certain elements may be prescribed to patients to increase the speed. Whilst the MRI is scanning, the patient is required to lay completely still. Already, this amount of information as to the workings of the MRI explain why one may consider it less efficient, though more effective when it comes to detecting tumors in the brain. It may take an hour for an MRI scan to complete, though the fruits of its labor include highly detailed anatomical and functional imaging, which is considered a much more effective tool when locating and describing brain tumors. The detail of soft tissue that is provided allows an easy diagnosis, as well as determining the most suitable treatments for tumors, furthermore making surgery much easier when required in contrast to a CT scan. In terms of effectiveness and efficiency, the CT scan is more time and cost efficient, as MRIs tend to be much more expensive, and MRIs are more effective with diagnosing. One concern with regards to the CT scan is that the large number of X-rays that a CT scanner uses will no doubt involve a level of radiation exposure, which in younger patients may cause a higher risk of them developing cancer later in life. As the National Cancer Institute has stated in a 2024 fact sheet, after 12 years of a single CT scan, the risk of cancer was about 1 to 2 out of 10,000 scans for young people. In spite of this, parents and patients will generally be informed of the risk, also answering questions to determine the eligibility and necessity for the CT, hence its continuation of usage. With MRIs, a lot of people may be unable to use them, as any metal in or on the body must be removed, otherwise the machine cannot be used. As aforementioned, it uses an extremely powerful magnet. Any unnoticed metallic objects within or outside the body may cause freak accidents, thus is treated very seriously. Another problem with MRIs is those who suffer from claustrophobia or similar phobias and anxiety issues may be unsuitable for its usage, as it encompasses the body in order to produce the necessary field for scanning. And if a patient does not comply with the requirements of the scan, which is having to stay completely still, the quality of the image produced may be quite blurry or sometimes even unusable. This, and it being quite expensive, may play into the doctor's treatment plans for those patients who are recommended for either scan. Generally, the most common usage of the CT scan is in emergency cases. The speed and cost will provide enough insight to determine the next step in treating someone who suddenly suffers a stroke or deals with a tumor, and the need for an MRI may be unnecessary in such emergencies. This may be recommended for those who are obviously suffering from symptoms of tumors, such as pain and psychological problems. MRIs may also be prescribed in addition or in non-emergency situations to allow for surgeons and related doctors to measure the size, shape, location, type, and surroundings of the tumor or tumors, and is especially used for pre-surgical planning and long-term monitoring, as understood in the 2022 Journal of Magnetic Resonance Imaging. MRI is nuanced in that there are different types which provide a multitude of different sets of information. T1, T2, DTI, and fMRI, each highlighting fat, water, brain connectivity, and changes in blood flow and oxygen, respectively. To put it simply, CT for speed, MRI for detail. Closing the book on that debate, it's important for us as students of neuroscience to understand that these approaches complement each other and are often used in tandem, since both provide an abundance of neurological information. We can conclude that yes, CT scans are usually for the average Joe, whereas MRIs are usually for special cases. And yes, MRIs are much more useful for their usage in treatment over diagnosis. Neither scan should be pitted against each other, as they are used for different reasons overall, though critically reviewing these machines allows us to further their progression and making them more efficient, more effective, and most of all, safer. Thank you everyone for listening to this episode. All credits and references will be provided in the transcript for this podcast. I hope you've learned something today and enjoyed this podcast. Peace to you all. And I'll see you next week on your weekly dose of neuroscience.